Well, again, welcome to Health and Human Services. Thank you all for coming today. Madam Clerk.
Commissioner Baker McCormick. Commissioner Marecki has requested an excuse. Commissioner Anderson has requested an excuse. Commissioner Killeen. Chair Scott.
Present.
You have a quorum present.
Thank you. Okay.
B, Chairwoman's
Next item.
remarks.
I have none. Thank you. Next item.
C, approval of the August 27th, 2024 meeting minutes.
May I have a motion?
Move
please?
approval of the previous minutes, Madam Chair.
Support. Moved by Commissioner Killeen, supported by Commissioner Monique Baker McCormick. And I vote yes. All in favor? So I
Aye.
hear none.
Aye.
Okay, opposed, so motion is approved. Next item, please.
D, unfinished business. There is none listed. Moving on to item 1 and a new business. Board and report on the activities of the Cooperative Extension Services Program and the comparison for fiscal year 2021 to 2022 to fiscal year 2022 to 2023.
All right, thank you so much. All right, thank you. Introduce yourselves.
Good afternoon, Commissioners. I am Dr. Brianna Osorio, the Director of Public Health Division. And this is a performance report that's required for our Michigan State University Extension Program. So I have Director Richard Wooten, who's going to be here presenting the comparison report for you.
Yes, nice to see you again.
Thank you very much. Richard Wooten, District 11 Director, MSU Extension.
Yes, thank you, Mr. Wooten.
This summer is going to be pretty brief. We're required to provide this report every year along with our annual report. And what's helpful about this report is that we have an opportunity to compare year to year. So I guess the good news is that we saw an overall increase in overall reach of about 700 participants. That's the good news. We also saw an increase in youth participating in extension programs. That was almost a 3,000 participant increase from year to year. So we're excited about that.
Okay.
The only place we probably lost ground or we had some challenges was the Master Gardener program. We did see a reduction in members, about 63 Master Gardeners. We lost between the 2 years, and we lost about 3,000 volunteer hours. And part of that reason that this happened was really because we kind of did some house cleaning. We started looking at those members that were active. And when we started looking at those members that were active, we saw a lot of inactive members and we just removed them from the files. So we're down to about 262 Master Gardeners for Wayne County. We were, in 2022, we had 325 on the books. So we just cleaned up our books and we lost.
You lost
members.
them, but you gained a lot of participants. Why do you think you
Well,
gained
we
so
gained a
many?
lot of participants overall for all of our programs. Because you got to understand, the Master Gardener program is just one program. The Youth Development program is just one program. When you look at mindfulness, when you look at all the other different programs, when you look at nutrition, when you look at the whole litany of other programs that we provide, overall, we reach more people. But we did have to do some house cleaning with the Master Gardeners. We had a couple of people who actually, they were reporting their hours wrong. And when we went back and did the audit, we had to discount quite a few of their hours. So we lost about 3,000 hours doing the audit.
Well, thank you for your work.
Thank you.
Any questions from the commissioners?
Yes.
Go ahead, Tim, please.
Thank you very much, Madam Chair. And just to remind me, because you were talking about Master Gardeners, people who take that program are expected or obliged to do some community work as a result of what they're learning?
Yeah, Commissioner, you have a good history. They used to be required to do volunteer hours and become a Master Gardener if they wanted to take the classes. So it wasn't optional. What we've done now is we've gone to a system where the volunteer work is optional. So it's called Foundations of Gardening. They can take the class now. They can get the content. They can get the information. It's a 10-week class, and it's $350. They can take it. They can get the content, but they don't necessarily have to move on and become a Master Gardener. But we do have a track for those who do.
Okay, because they do a lot of community or, do you still track how many people are taking the courses and doing the volunteer work?
Yes, we do. We still track those.
And how is that going, even though it's not a requirement?
Probably about maybe 30% right now move on to become Master Gardeners. A lot of people have complained that they've always wanted the content and the education. Again, it's a 10-week class. And what we're going to do that's differently in 2025 is that we're going to have watch parties. We changed that class, and it's primarily an online class with online homework assignments, and it looks more like a university-based class. We realized that for a lot of seniors, that's probably not the best way to operate, and a lot of them, they like being able to come together and have conversations and meet and talk and discuss. So we're going to do a series where we're going to have watch parties. And these groups are going to come together and they're going to be able to take the content together as a group. And we're hoping that will change the number of people we have participating and the number of people we have that will go on to become Master Gardeners.
Thank you. Thank you, Madam
Sounds
Chair.
good. Thank you. Thank you so much. Oh, Commissioner McCormick, please.
Thank you, Madam Chair. So I just want to commend you on the programs that you provide, in particular, the youth programs. I know you're going to be assisting us again this year with our Wayne County Commission Youth Council. In fact, I think the second session, you guys are participating. So just want to say I appreciate it because, you know, our youth are our future. So,
Yes.
yeah, so thank you.
Thank you.
All right. Okay. Thank you both. Okay, I guess we need to vote on this.
Yeah, Madam Chair,
Okay.
can I make a motion to
Mhm.
receive this? Huh? Well, I don't know.
No. It doesn't say a receiving file.
Oh, first one is a receiving file.
Yeah,
It
it
You
is.
could,
Okay,
I mean, you could take them all together or separately, it depends.
okay, we can take them all together. Okay, next item.
Item 2, revision of resolution number 2024-621, amendment 2 to a 4-year memorandum of understanding, acting through the Department of Juvenile and Youth Services and the Wayne County Prosecutor's Office.
Madam Chair.
Yes.
Yeah, we've already approved this. This was just a matter of putting the wrong what?
I'm sorry.
The wrong account number.
Yeah,
Oh,
just the wrong
okay.
account number to
Okay.
this. So that's all that this, because they changed over there and they started putting everything into this prevention.
Glad you
diversion.
remember that.
So-
Anything else you want to add to?
No,
No.
thank you.
Okay, well, thank you so much. All right, well, we're gonna move on then.
Item 3, requesting commission approval of Amendment 11 to a 2-year contract with 3 one-year options to renew with Black Family Development to account for the fiscal year 2024 third quarter payment adjustment and the fiscal year 2025 rebalancing, and to continue to provide comprehensive treatment plans to juveniles in accordance with requirements of the juvenile justice system.
Okay, you want to speak on that?
Good afternoon, Melissa Fernandez, Director of Juvenile and Youth Services. The next 5 items on the agenda are our contracts with our CMO organizations, and it's our quarterly adjustment for the third quarter, but it also is requesting approval of the 1-year renewal option to continue services for our post-adjudicated youth.
Okay, any questions on any of these? Yes, Commissioner McCormick.
So for Insight, can you give me an update on what's going on? Because that's in my district, as well as they were going through some changes and,
Correct.
yep.
So Insight, recently, Michelle Rouser was their CEO for many, many, many years. She retired a month ago, and Tawana Rogers Reese is their new CEO. Last week, Insight announced that they were merging with Vista Maria. And so Vista Maria will now take over, back-end operations, allowing them to focus more on the community intervention and the therapeutic piece that's needed for the young people, and that's been missing. I did invite Tawana to this meeting to talk a little bit more about that, and she was unable to attend, but she looks forward to attending in the near future.
Okay, and so because of this merger, I guess we'll see some conformity in their practices there. Is that correct?
Correct. So we did have an initial meeting with them, and we spoke at length about that. And as we were waiting for them to make this announcement and moving forward, we'll be able to update the commission on that.
Thank you.
Thank you.
Thank you,
Okay.
Madam Chair.
You're welcome.
Yeah.
Commissioner Khalil.
Yeah,
please.
thank you, Madam Chair. On that Insight, Vista Maria discussion, are we involved at all in the discussions of merging to say, hey, we have to have this, we have to have that? Is this going to be a new contract or just a continuation?
It will be a continuation.
And so do we have to say, okay, we see what you're doing. You can keep the same contract for certain like requirements or whatever, that you've met these requirements? Are we involved in a discussion like that?
So we will be, and part of the conversation is, do we need to amend contracts moving forward since there will be a change?
Sounds good.
Okay.
Thank you. Thank you, Madam Chair.
Anything on the others you
No.
wanted to?
Nope, nothing at this time.
Everything is fine. Okay. I do attend some of the community meetings that they have with Black Family Development. And they just do tremendous
They do.
things with those young people in the community,
They
and
sure do.
just
They're a
excellent.
great partner.
Yes. Yeah, Kenyatta Stevens is just a great director.
She sure is.
Yes, yes. All right. Well, thank you so much. We can vote on those now then. A motion.
Make a motion to approve items
5.
1 through 5. Okay. Or is it
Oh, it's
7?
7. I'm
Okay.
sorry, it's 7.
With 1 being a receiving file.
At 1 being.
Yeah, being
received and
received and
filed.
filed. Okay. It's been moved by Commissioner McCormick, supported by Commissioner Khalil, and I vote yes. All in favor?
Aye.
Any
Aye.
opposed? Hearing none. Thank you. Next, that's it.
Moving to the addenda.
Yeah, damn it.
Item 8, revision of resolution number 2024-027, an intergovernmental agreement with a 3-year option to renew with Wayne State University Center for Behavioral Health and Justice.
Okay. Anyone want to speak on this?
Sure.
Yes.
This is another one with account numbers. We've already approved
Okay.
this.
Okay.
But I would like to hear what is the status of actually having these
Mhm.
machines out there? And first of all, are they out there? Second of all, do we know anything about, if the answer is yes, do we know anything about how they're being used?
Dr. Abdul Al-Sayed, Director, Health Officer, HA Health, Human and Veteran Services. Thank you. So we have deployed our first 9. They are mainly in county controlled properties. So there's one downstairs in the Guardian. We're trying to get it moved because it's like they put it in the furthest to reach corner, which kind of defeats the purpose, but we're actively having it moved. But there are a couple at the CJC. We have one at the HAB and so on. And we've been working closely with community to place these. And as you can imagine, the placement is not without its stigma, which is part and parcel of the challenge. And so we are in active communication with several community members, and we feel pretty good about being able to place those first 40. And then we'll continue to work and get them out. It's too early to tell in terms of the use, but we are actively collecting data on the Narcan that is being deployed, and we hope to be able to offer more of that data as it matures.
And 100 machines, you're talking the first, how many?
The first 9.
Yeah. Does it look like we'll get 100 out there?
We'll get 100 out there.
Okay, good. Thank you. Thank you, Madam Chair.
Okay, thank you, Commissioner McCormick.
So I did reach out to Retford Township and I just recently left a message that they are interested.
Excellent.
So
And
that'll be great.
Commissioner, you're in
Get moving.
contact with our team on this, right? Was that?
Yes,
Perfect.
yes.
Excellent.
But also we asked in the maybe last meeting before last, about actually getting a kit ourselves or whatever comes in the I don't know, I don't even know what it looks like
Okay.
in the vending machine. That's what I'm saying. So I think we should all have one. We should have probably one or two on the floor. I don't even know how to use them per
Okay.
se. I know it's supposed to be something real simple. You put it in your nose or whatever. But I think commissioners should, or staff should at least know what we have on hand and how to use it.
Absolutely.
So if at the next meeting, even if you could just show us, that would be great.
So what I think
Mhm.
would be ideal is we certainly can get you some here. There's obviously it's you know, when on your way downstairs, you can literally just go to the machine and get them. But we'd be glad to have one of our staffers, if we put a time together for you and your staff, just to show you how they're used, and how they come, et cetera. And maybe that'd be the best way forward, just to make sure everybody feels comfortable with it and knows how to use it.
Okay, so where is it in the Guardian?
So,
Valley?
yeah, this is what we're trying to
So,
fix. So
yeah.
if you walk by the main security desk downstairs, there's this room that's behind this sort of grated gate. That gate is open. And if you look directly into the gate, you'll see where the laundry is. That's where the machine is going to move. But right now, if you go inside of that little room, it's directly to your right. And so obviously it defeats the purpose if people
Yeah.
can't see it, which is a frustration of ours, which is why we're getting it moved. But it will be visible to anybody sitting in that little vestibule or be in that vestibule after we move it. So we're working with the building staff to get it moved.
Okay.
Go ahead,
Yes.
Tim.
Yeah, I forgot one thing. Can these go in high schools?
Yes.
Okay.
And we'd be happy to work with them. Obviously, it's just an important conversation that we need to share with the high
Absolutely.
schools to make sure that they're,
As well as other municipal buildings?
Yep.
Could take them? Okay.
Yep.
Didn't know if there's any restriction. Thank you.
Well, every fourth Monday, I do coffee hours in my district. And yesterday, we were able to get training. There's an organization across the street that does the training for that. And everyone that was at my coffee hour was able to go across the
Oh,
street
great.
and get the training.
That's
And
fantastic.
it was just awesome. So they all got kits.
That's excellent. I'm glad
Yes.
to hear that.
Yeah.
Who's the organization?
What is it? Virginia is the director and they get theirs through the health department, DH.
Okay.
Yeah. What is that name of that organization? Because I had intended to invite you to it since they were going to do it. And I got the training last year.
Okay.
Yeah, what they were
Very cool.
doing.
When you remember, just drop me a text or, and I would love to connect with them.
I will.
Thank you.
Yeah, they're on Joseph Campus and just north of Caniff. And they've been in business for quite some time and they work with basically with the youths
That's great.
in Hamtramck schools and that. Mhm.
Just a quick question and clarification, because what you just said is everyone got a kit. Are we looking at providing just the general public with a kit, or is it just suggested as needed?
So that's the point of having the vending machine, is that it's a free vending machine. You literally can just go.
Right,
Yeah.
but is it as needed? Like, oh, we have a vending machine, let's run and get it because someone is having.
The idea is,
Or we should all, is the recommendation that we all just have one in our car or at home?
yeah, that's the recommendation.
Okay.
The tough part obviously is deployment, right? And
That's-
so
Mhm.
the value of the vending machine is it's a vehicle to deploy
think
to
of the
everybody,
name.
right?
Right.
So the recommendation is everybody should have one and pick them up where they need them and then have them on them wherever they may be.
So at our community meetings, as the commissioner just said, I'm having one tomorrow in my district. is there a way that we can get some for everyone at the meeting tomorrow?
I may not be able to get it to you tomorrow, but what I can tell you is when you have a community meeting, if there's an opportunity if you can reach out to us, we can make sure to get it to you. The key goal for us really is to have these placed over time so that, you know, folks know where to go and they can get them whenever and wherever, or whenever they need them
Okay.
from a place to get them, rather than
Right.
sort of being in the position where you're always trying to deliver to this meeting or that meeting.
I will give you the number of this organization,
Thank you.
and I think that they will even come out because they told everyone at the meeting if they want to get some training, and they just call them and they would be glad to. Yeah. All right. Thank you, Doctor.
Thank you.
All right. Motion on this? Yeah. Yeah, we'll take them together. Okay, next item, please.
Item 9, requesting commission approval of a 1-year grant agreement with the Michigan Department of Health and Human Services to accept funding through the fiscal year 2025 Local Health Department Comprehensive Grant to carry out program activities for numerous local health department program services.
All right, thank you, Doctor.
No problem. Dr. Brianna Osorio, again, Director of Public Health Division. And this is just for the grant agreement for fiscal year 25 for our comprehensive grant from MDHHS for all, you know, these funds are basically distributed across our central local public health services to support central local public health services. We have not much variance from the previous year, but there's been variance just depending upon the amendments that we received throughout this last fiscal year. So pretty much matching around what we expected as well to support our programs. So.
Any questions? Tim?
Thank you, Madam Chair.
Mhm.
They just send this to us, right? They're not calling us up saying, what categories do you want?
They sent this to us, and it just specifically letting us know the allocations for all of
That's
our
based on
programs.
their
and
funding.
Based
up
on their
there,
funding,
not
yep.
necessarily our needs here.
Right,
Okay.
exactly.
Thank you.
No problem.
All right. Monique? No, okay. All right, thank you.
No.
Next item, please.
Item 10, requesting commission approval of Amendment 1 to a 3-year contract with 2 1-year options to renew with House Arrest Services to cover the cost of monitoring technicians, installation technicians, a court liaison, and administrator to continue to provide electronic monitoring services and support for juveniles placed on tether.
All right, Director.
Good morning, Melissa. Good
Morning
afternoon.
again.
Melissa Fernandez, Director of Juvenile and Youth Services. We're requesting approval for our amendment with our contract with House Arrest. And what we're requesting is adding additional funds so that House Arrest can add monitoring technicians, case management, and court liaison and installation for our young people. To give some background, we have more young people today on tether than we've had in the last 2 to 3 years. Today, we have 117 young people on tether. This summer, we were well over 150. With juvenile justice reform beginning October 1, we will be required to start using the SCAO approved detention screening instrument, which means there will be a decrease in eligibility for JDF. Our number will go down, meaning we'll have a significant increase of young people in the community on tether who used to be eligible for detention but aren't anymore. And with that being said, we really need to increase the services that we're doing with House Arrest to enable a professional company that does this for a living to monitor the young people 24/7. We don't have that right now. House Arrest provides the tethers, but they don't provide the monitoring. And what we're seeing is because we have so many kids on tether, we are having issues with some of our monitoring and the way the monitoring is happening now, where we're having lapses in tether monitoring in issues with public safety. And so we feel because of the increase of young people in the community and the significant increase that we will see after October 1st, we need to turn that over to House Arrest and let them do what they do best with the adults in our community.
So what's the difference in the youth or the ones that are adults that are on tether?
There's no, I mean, you can speak as far as House Arrest, Ryan, what you see, but
Ryan Hall, House Arrest Services.
So the difference is between the youths and the adults in there is the Wayne County Sheriff's Department has a tethered unit that literally monitors them as case management
Right.
officers. They go and apprehend them if in fact they violate the program. So it has its own tether unit.
Okay.
And the juveniles do not have that same.
And
tether.
so, and that's what you will need, what they are doing,
Correct.
monitoring there. Okay.
Correct. This will increase the cost of the contract. This is 25% eligible since October 1. Community-based services are reimbursed by the state at 75%.
Okay. Any questions on this? Tim?
Thank you, Madam Chair. So they're gonna pick up 75% of this cost that we're looking at?
Correct.
Okay. What's this change of policy? If you could say a couple of more words
Sure.
about it, about being eligible for detention?
Sure.
You said it in a way, I'm like, sounded funny. So what is that change?
Sure. So juvenile justice reform is obviously the state's reform efforts to pivoting juvenile justice in moving towards more keeping young people in the community, right? Part of that is SCAO's they were required to choose a DSI, a detention screening instrument that would screen young people at the front end to determine which kids are eligible for detention. Right now, there's a list that's an automatic admission list. Law enforcement picks someone up, they automatically bring them to JDF. That's changing October 1. And so there are 6 questions that are being asked that'll determine whether or not young person is eligible for detention. And the reason for that is, are we using detention for the purpose of having, life offenders or dangerous people in there? And to limit the use of detention based on young people that shouldn't be there, low-level offenders. And so that goes into effect October 1. That is a SCAO mandate based on juvenile justice reform. Whether we agree or not, we will be in compliance with that. I do have to add that Wayne County believes the MJAS DSI will increase our admissions because of the biased questions that they ask. And so we are working with Casey Foundation. We've been working very closely, and we're developing our own DSI tool that will be used in conjunction with the MJAS that fits our community and the young people that we serve. We will not be ready with that October 1, but by the end of October, we will be ready.
So I guess kind of like standardized tests, different communities have different, you refer to it as DSI, the 6 questions.
Yes,
That those questions are more appropriate in some communities than others. Is that the idea?
you got it. Exactly.
And now I see we got the are we able to track, do we have numbers like, how many of these tethers just disappear, get cut off? Do we have those kind of numbers?
We do.
For what is out there? I know that's sensitive, but I'd like to see those
Sure.
numbers and get a sense for, how this is, what the effect is out in the community when you have 120 kids out there or whatever.
Absolutely.
Some idea of how much compliance there is or is not with that.
Absolutely.
So I think committee members, would. Thank you. This
Yeah,
sounds
thank you.
good.
Love to have that.
Yeah, this sounds good though.
Yes.
I will absolutely get that for you.
Thank you. Commissioner McCormick?
Thank you, Madam Chair. So yeah, we got this, I think, yesterday. So I might ask a question that may be in our report. The breakdown of the cost of the tethers and how many tethers are we getting? That it looks like a $5 million contract, and that's
That's
yeah.
based off of the use of 150.
150. Okay. And so I don't know what the math is, but I guess it's 150 plus we're paying for monitoring as well. Is that correct? Or just for the tether?
That's everything.
Okay. Right?
That's
No?
everything. That's monitoring, that's the
Okay.
tether, the equipment, the court liaisons, the case management team, that's everything.
Okay, so that's for actually a
Correct.
team. And how many is on that team of
Of
that's
case
coming?
managers?
Yeah, case managers. And I thought that that was part of what the CMOs were doing
Right. So
as well.
That's part of the barrier. The CMOs were doing it. When we had 20 and 40 kids, that was one thing. And the problem that we're seeing now is young people are cutting off their tether or tethers are going dead and we're not receiving notification. House arrest isn't receiving notification until days later. And so the monitoring is not being done. House arrest will be monitoring 24/7 and will be on any tether tamper within seconds.
Okay.
And I'm gonna speak on behalf of Ryan, but I would love to have you come out and see their operations and what that looks like. So.
Yes, please invite us.
We would love to have. you.
We would, okay.
But
Yeah.
and on a serious note, that we just take this very seriously. We've been working with this agency very closely for a long time.
Mhm.
And we have developed a wonderful relationship with them, and all that we see is that there is an abundance of what is going on as far as the amount of youths being let out on electronic monitoring and what's happening with them in the community. And we want to help that situation, as Melissa expressed on over there, to where the CMOs are limited to hours of operation to where we are not. And the connections that we've made over the years with the Wayne County Sheriff's Department, local PDs, is going to do nothing but enhance this program.
Yeah.
And that's what we want at the end of the day. These are children, and we take a very vested interest in that. So we approached and wanted to work together to provide a wonderful solution for these individuals, for these youths, and a program that worked for them, it worked well, provided options. So that's, and make sure that these kids go home at night. That's
Okay.
it.
So- So can you tell us what that looks like though, when you, so you have a kid, a youth on a tether, and I don't know, does an alarm go off if he's outside that radius? Then do you then go to their home? Are you in contact with the parents? Do you build a relationship with the parents, or the family? What does that look like overall?
Absolutely, all of those things. So depending on the alarm that gets generated, just depends on the amount of actions that are taken with that. So it could be something as simple as a phone calls, could be that we're calling the or the Warrant Enforcement Bureau in order for them to go pick up an individual. So it can range anywhere in between there. So, but the amount of contact, where we're contacting them, that's the kind of the difference into this. To once again, at all hours, doesn't matter, nights, weekends, we're taking care of those things, handling those things. And then, excuse me, some of the other things as far as the court liaison and the representation in that. So currently we have somebody that goes and represents tether violations, all the information into that, that pertains to that, because it can become complicated when you're talking about cell triangulations, things like that. We want to have a representative in there that is actually representing the information and accurately for the individual. So that's part of something in the process that we're getting into there. So all the way through, we're looking at the installation process, the monitoring process. If in fact there's a court issue, that we go in there, and once again, this is for the representation of the individual and the information that is generated from the tether, so that it's just accurate, so that they know exactly what this youth did when they were on there.
And if I can add, the CMOs will still have case managers that are managing their young people on tether. House arrest will be doing the case management as far as watching the tether violations 24/7 and communicating with the CMO case manager and saying,
Okay.
hey, we have this issue, right? So now the CMOs are concentrating on the providing the care and the care of the youth, while these guys are doing the
Not
custody.
necessarily watching. Yeah,
Exactly,
okay.
exactly.
Thank you.
Yes, thank you. So your organization is the one that goes out when they find out that they have cut the tether off and find out where they're located.
We inform the the Warrant Enforcement Bureau, the Wayne County Sheriff's Department, local PDs. We inform them of those things due to we are not trained to apprehend a youth. So we in turn share that information with the proper authorities.
So our sheriffs have to go out.
Yes.
Law enforcement.
Law enforcement, correct.
Okay. All right,
Madam Chair.
Tim, please.
Thank you very much, Madam Chair. I'm just gonna guess at this, that if there's holes in the system, word gets around, yeah, tether's no big deal. You don't have
Got
to
it.
worry. Yeah. Is it ever the case where local law enforcement will pick a kid up and then call us and say, hey, by the way, this kid should have had a tether on? Do local law enforcement know that when they run into a kid?
Yes, so local law, you can speak on
They
that,
can
too.
look up the record and say, hey, they should be on a tether.
9 times out of 10, they already know. it's located into the software. And then we get calls all the time just expressing that. And we also get the calls saying that we have this individual on camera, et cetera, et cetera. Can you give us the data information? We generate these reports. We provide everything to law enforcement that we can
But
to
is it
assist
ever
in
the
the
case
process.
We hear from law enforcement, hey, we picked this kid up and he should have been on a tether, but they're not there. Do we get notified that way?
Absolutely.
Okay,
Okay,
thanks. Thanks, Madam Chair.
all right. Thank you. Any more questions? All right. Thank you so much.
Thank you.
Thank you.
Okay, I guess we can have a motion now on all of the,
You have a second addenda?
we got another one?
Unless you want to take the second addenda first, I guess. Up to you.
Well, that's right. There's another addenda. That's right, because it just
As
came.
far as the eye can see.
Yeah, right. Okay. Right. Next item, please.
Item 11 on the second addenda, requesting commission approval of an intergovernmental agreement with Wayne County Conservation District to provide per and polyfluoroalkyl substances, research, and educational services.
Okay, let's see what negative was. Thank you.
Hi there, Dr. Avni Sheth, Division Director for Clinical Care Services and Chief Medical Officer for HHBS. This is a request for approval of an agreement with Wayne County Conservation District. This supports their general operational support for their work that they do, various different operations support for environmental work that they do, including around PFAS and informing Wayne County communities of these risks and working with state and local partners on these efforts. And so this partial support for their overall mission of that entity, of that government entity, the total amount is $150,000 and it goes through September 30th, 2026.
Okay, Tim,
Thank you, Madam Chair.
thank you.
Conservation District already has a pretty good database on PFAS and aren't they doing some work with the state on PFAS in Wayne County?
Yes, that's correct. They have been working in this area for quite some time and working with state partners on MDHHS's PFAS team and working on kind of the local sites in Wayne County and
Yeah.
increasing awareness.
And I'm glad to see that hopefully there's a map that's produced where the high concentrations are in the county.
I believe that the state has PFAS sites throughout the state of Michigan, and specifically in Wayne County. And so we can find that link and share that.
Yeah, are we gonna build? Because, PFAS, one of those things that's in the news, and I don't think the general public is like, yeah, PFAS, I hear about this, I see, that really what it is and what the effects are. So I'm glad we're doing some public education on this topic, because it's huge. And I would think even better if we had like a little map of the hot spots in Wayne County where there's high PFAS concentrations. I think that would also be good for the public to know about. These are nasty stuff. So, okay. All right. Thanks, Madam
All
Chair.
right, thank you, Tim. Monique, you finished, okay. All right, thank you. Next item, please.
Item 12, requesting commission approval of the fiscal year 2025 project allocations for emerging threats, local health department grant agreement with the Michigan Department of Health and Human Services to provide continued support for the COVID immunization project.
Dr. Avni Sheth, Division Director of Clinical Care Services. This is a request to approve and certify the annual grant funds we received from the state. This, just to remind everybody, this is our agreement with MDHHS and specifically around projects around emerging responses and efforts. And so this funding of around 1.2 million that goes through the next fiscal year provides continued support for our COVID immunizations efforts in Wayne County.
Okay. Any questions? Okay, next item, please.
Item 13, requesting commission approval of a 5-year sole source professional services contract with Global Vision Technologies to provide maintenance, hosting, and support services for the FamCare Software Juvenile Accountability Information System for the Juvenile Detention Facility.
Thank you. All right.
Melissa Fernandez, Director of Juvenile and Youth Services. This is a request for our 5-year contract, for approval of a 5-year contract with GVT. GVT has been the provider for our Juvenile Accountability Information System. What that is our JAS system. Our entire system of care is captured in this database. That's treatment planning, case management notes from our CMOs, our court, our YAP providers, our entire system of care. So I'm able to provide data and in my annual reports and data reports because of the system that we utilize at Wayne County.
Okay. And this is through 29. Okay. All right. Any questions, Tim?
Yeah, and refresh my memory, until a couple of years ago, we used to call this the JAC, the Juvenile Assessment.
No, this is the JAS. This is actually a database system. This is hardware.
So we changed the name on the JAC. I thought.
You're
it's-
talking about something different. The JAC is AFS, Assured Family Services, the Juvenile
Yeah.
Assessment
The
Center.
intake of people
Correct.
getting their data.
Correct.
This is going to be,
This is our data platform, our software.
for the entire, for the
Correct.
department, the whole.
Yes, you got it.
Okay, kit and caboodle.
Yes.
Okay, cool. Thank you, Madam Chair.
Okay, thank you. Monique? All right. Thank you so much.
Thank you.
All right, okay. Now we need a motion for all of this. We got one more?
Turn it over on the other side.
Oh, my,
There you go.
I didn't look over. Wow.
And this one will be contingent.
Oh,
on-
that's what we were talking about, 14, okay. All right.
Item 14, requesting commission approval of a comparable source professional services contract with 2 one-year options to renew with the Vision to Learn for the Department of Health, Human and Veteran Services, Will Wayne Mobile Vision Program.
Good afternoon, friends. Dr. Abdul Al-Sayed, Director, Health Officer, Wayne County's Department of Health, Human and Veteran Services.
Aja Harris Martin, Chief Programs Officer for Wayne County Health, Human Veteran Services.
Thank you. All right.
So this is a great day. And I just want to, before I say anything else, I want to say thank you to all of the hardworking, lovely people who staff this commission for your diligence and for making more addenda than I knew was possible. So I just want to say thank you truly from the bottom of my heart. Really appreciate it. I also want to note that I see many glasses on faces here, so you know the importance of this work, which gets me to the task at hand, which is that our goal with this contract is to put glasses on kids who need them. And just to share, this is a project. We built a very similar project back when I served the city of Detroit as health director. And this program ended up putting about 5,000 pairs of glasses on kids who otherwise would not have gotten them. And I just want to share, I remember giving a lecture at a intro public health class at the University of Michigan. And there's this young woman sitting in the front row, and she was wearing a pair of gold polka dotted red glasses. And I thought, that's a really interesting fashion choice for a freshman in college. So I gave my lecture, and she waited till the very end after everybody had asked all their questions. And she said, "Hey, do you see my glasses?" I said, "Yeah, I do. They're kind of hard to miss." She said, "Yeah, well, I got these glasses when I was a freshman in high school. And before then, I was not a very good student. I just thought I didn't have it in me. Turns out I really just couldn't read because I couldn't see. And at that point, nobody had diagnosed me as needing glasses. And I learned about this program and realized that I got these glasses in the first year that the city of Detroit rolled this out. So what we're aiming to do is to do exactly this for 14 school districts, 15?
Growing, yeah. it's
Growing. So 13 plus or 14 plus school districts in Wayne County. And what the program does is it builds on our extant resources. We, as a matter of state law, will screen children for vision deficits, but that screening doesn't really tell us what's wrong. It just tells us that there is something wrong. And the way the program is supposed to work is that kids will take this information to their families. The families then take them to an optometrist where they then get fully tested and fitted for glasses. Too often, though, that second part doesn't happen. And so we know from our own data that too many kids come back testing positive for vision deficits again, meaning we knew that they needed glasses, we just couldn't get them a pair. And what we're trying to do is finish that last mile. And we're doing that in partnership with an organization called Vision to Learn. Vision to Learn is a leader in this space nationally. They're the organization we worked with in the city of Detroit. They have extensive knowledge of the county, and they've been able to bring about half the project cost in philanthropic donations to this work. What they do is they put an optometrist on a van and they bring it to the school so that when a child tests positive for vision deficits, they literally can go to the van, get the optometric exam that they need, and then have a pair of glasses delivered to them within a couple of weeks. And as I shared with you, the reason I shared that story is because this truly can be a life-changing experience for a number of children, and the ability to bring that to Wayne County kids has been a big goal of the county executive, and it's been a big goal for us at our department and in the public health division. So we're really excited about the potential here and grateful to be able to bring this to you.
And when are we doing that?
Well, should commission smile on this project, then that would start on October 10th.
I'm smiling on it right now.
All right, well,
We haven't voted.
Well, we gonna do it because it's Highland Park.
yeah, that's right. So October 10th, we would be kicking off. We are starting with a set of school districts. In fact, Aja and I recently presented to Wayne Risa's meeting of all the superintendents, and we want to work with all of them. Our goal is to be able to deploy this across Wayne County.
Correct. So what was that date again, please?
October 10th,
I got a lot of
10,
stuff
10,
on October
24.
10. What time?
11 a.m. It should be on your calendar. So
11 a.m.
prioritize it at Barber Elementary.
Yeah, Barbara Elementary.
We knew we needed to start with the most important town in Wayne County, so.
And I've got all this information for you
Okay,
that you asked for earlier.
appreciate you.
Okay. Yes, Monique.
So I think this is awesome. I
It
really
is.
do. The only question I have really is to it being a comparable source. I know you said that this company, this is their expertise. But did we look at any other programs like this that we possibly could have used, or how many programs out there like it?
So the
Yeah.
reason we requested from our procurement department to have this comparable source, there were three reasons. The first is they already operate in Wayne County. They actually, in fact, already operate in school districts that we want to be able to spread to. So there's a level of knowledge in this in the work that is extensive. And on paper, this is a program to assess for vision deficits and cut glasses. But it's actually a lot more than that. There's a lot of interplay between the school districts to be able to get the consent part right. And they have a lot of extensive experience with that. The second is that they were able to bring half of the project funds in philanthropy. And so, we're basically, this project will cost us twice as much if we were to go with another provider. And then
just to be clear, it's not going to be half of this
no, this
the
is half
dollar
of the
amount.
total.
of the total.
Yeah.
Okay, okay. Just want to be clear.
And then the third reason is there is absolutely no structural reason why this program should not be fully sustainable on its own terms over time. The reason that it is not sustainable on its own terms over time is a function of Medicaid bureaucracy at the state level. So the way that our Medicaid system works is, we know Medicaid is the federally funded, state-operated health insurance program for low-income folks. And Medicaid works through a series of what are called managed care organizations. And the hard part is each of them have their own billing system, and you can't really know what Medicaid eligible child, for example, sits under which MCO. And so that means that it becomes really, really difficult to bill Medicaid for the services that you provide, right? Now, this could be fixed if the state Medicaid office decided that this program should be directly billable to Medicaid for the services that we offer. And one of the reasons we wanted to work with this group is because they've been involved in doing that back end work to try and push our state Medicaid to make this directly billable. Because you could imagine over the next 2 years where we as an organization, or they as an organization, can start to bill Medicaid directly for the services they offer, and that we don't have to pay another dime to do this because Medicaid pays for the kids that it sees and it funds the whole program, right? And so getting there from a strategic standpoint is a primary goal. And so we felt that partnering with an organization that understood the bureaucracy involved in doing this and had done some of this work was a real priority. For all three of those reasons, we felt that a comparable source was necessary.
Okay, and then how many young people do we think we can help?
Yeah, so over the next 2 years, we're hoping to screen over 50,000. And then we're hoping to give out nearly 12,000 pairs of glasses to students.
Right.
And that comes with 2 free pairs of glasses for each student.
Pardon?
Each
2
kid gets
free.
2 free pair of glasses.
Okay, thank you.
Eh.
6,000 kids.
Mhm.
Okay, and then when you roll this out, how are you deciding where to start? You started in Hamtramck, and does this include Detroit, by the way?
So the city,
And how do you,
That's
yeah.
Highland Park.
Oh,
Yeah.
I'm sorry. Highland Park, okay.
I
So the city-
represent both. I
Yeah,
represent
thought
both
so.
of them.
Okay,
the
okay.
city already has this program running. Yeah, I literally built it when I was at the city there. And so they've got it going. Part of the challenge is we want to start at the confluence between communities with the highest need and communities where you have schools that can partner with us, because there's also a pretty big lift on the school side, right? And so those first school districts that we're working with are the ones that were willing to participate and where there was high need. Over time, we want to continue forward into ideally be able to run this across Wayne County. But you can imagine that the need for, the probability that a child who has vision deficits does not know it in a community like Northville is going to be very different than in a community like Highland Park, right? And so you want to really go to the highest need communities and then over time be able to spread further into more into counties with or parts of the county with fewer need.
All right. Thank you so much. Tim?
Madam Chair. So your estimates are based on the 14 or 15 districts that we are already in
Ye-
contact with?
Yes, and their student enrollment numbers. So as soon as this gets approved, we'll be able to actively update those student enrollment numbers because also that fluctuates, but yes.
So, 1,000,007, what's our capacity with that? I mean, because 15 is not there's a lot more school districts than that in the county. So what's our capacity with this 1.7 million? About how many kids we can reach with it?
Yeah, so if we're able to get efficient, which is, again, as soon as we pass this through commission, our teams are going to work with Vision to Learn on gaining those efficiencies to work with the individual school districts and the individual schools, because it really takes a partnership from that many levels. And what Vision to Learn has told us, as soon as we're able to update those student enrollment numbers, unofficially, we may be able to add at least 10 more districts.
With this funding,
Yes, with this funding.
and then hopefully we have more and you come back and say, hey, we need.
Yeah, there's 33
5
districts.
million.
Hopefully, the back end work we're doing with state Medicaid will pan out, and we will come back and report to you that we're now operating in all districts and we don't actually need any more funding because the program is sustainable on its own terms.
Is this a matter of bureaucratic rules that they can change, or is this a matter where we need the state legislature to say something?
It is, to our analysis, a matter of bureaucratic rules that, of course, can be trumped by the state legislature, right? The state legislature could act, but we also think that within the bounds of
Yeah, they don't.
Medicaid rule, that these could be changed without legislation.
Do we know if in any other states, are they providing this under?
Yes, it's
They
called,
are.
it's called the SPA. So that's the student-based amendment. So that is an option and a route and a pathway that Vision to Learn has worked with other states on. And that's what they're trying to work with our Medicaid on.
About how many states have already included this under their Medicaid rules?
That number, I don't know.
We know that there are states that have.
Yeah.
Which-
California being one of them.
California is where this program originated.
Okay.
Yeah.
Okay. All righty. Thank you. Thank you, Madam
Alright,
Chair.
Thank you. All right, thank you all so much.
Thank you.
And before you leave,
I'll get that and I'll see you in Highland Park on October 10th.
yes.
Madam Chair,
Yes.
I'd like to move items, and I think I have this right, 11 through, well,
14.
did we get the first?
14.
Eight.
No,
Eight,
that's
we
two
didn't,
of
yeah,
them.
yeah.
Oh,
the
we
two of
do.
them.
Oh, the
Eight
other
through-
two.
Eight
I
through
moved
14.
8 through 14 on our agendas for approval.
All
Right.
right. And
Support
supported
Through
by
14. Yeah,
Commissioner
Well, wait a
McCormick.
minute.
14. You just said
Yeah.
a different number, but
Okay, the
we know what
conditional,
you
I
mean.
forgot the conditional stuff. Can we please say that it is conditional on 14, our last one?
Okay,
What is it?
contingent
What it-
upon.
let's-
14.
We need it over the mics and it's contingent on what?
Do you want me to say it?
Yes, you said.
I'll say, okay. I'm sorry, I got a mic.
You got your own.
Sorry, Commissioner. Got it, my bad. Excuse me, Chris Albrecht, Policy Analyst for the Wayne County Commission. So item 14 will be sent back for corrections in Appendix B relating to the term. Already been discussed between Commission staff and the Health, Human and Veteran Services Department.
And so we'll see that at full board. Is the idea?
Yes, sir.
Okay, so then I move 8 through 14 with conditional approval of 14 for the necessary paperwork at full board.
support.
Okay, it's been moved and supported. And I vote yes on this. So all in favor, say yes.
Aye.
All right. Thank you so
Aye, aye.
much. Thank you, Madam Chair. Next.
Moving back to the agenda. F, such other matters as may be properly submitted before the committee.
I don't know of any.
G, public comments.
Anyone in the public, even in the audience right now, would like to say anything? Anyone in the audience? Seeing none, on the phone or however,
There are no hands raised on Zoom.
there is none. Next item,
Adjournment.
So move, Madam Chair.
moved by Commissioner Colleen, supported by Commissioner McCormick. All in favor, and I say aye.